Very good afternoon and welcome to our weekly media briefing with Montgomery County Executive Mark Elrich about the public health update and also the opportunity for the members of the media to ask your questions. I'm Lorna Vigili, Hispanic Public Information Officer for Montgomery County Government, and joining us today is Dr. James Bridgers, who is the Acting Health Officer, Dr. Earl Stoddard, who is Assistant Chief Administrative Officer, Mr. Sean O'Donnell, Program Administrator, Public Health Emergency Preparedness and Response for the Department of Health and Human Services, Ms. Kimberly Townsend, who is a Senior Administrator for Communicable Disease and Epidemiology, also from the Department of Health and Human Services. And joining us today as an additional guest is Laura Mitchell, who's the Chair for the county's Alcohol and Other Drug Abuse Advisory Council. Thank you, members of the media. Remember to use the chat during the Q&A portion of the presentation. If you do not have permission to record, use the chat to request it. And with that, Mr. County Executive, I toss it to you. Good afternoon.
Good afternoon, and thank you everybody for joining us today. I want to start just by talking about the first week of school. On Monday, I was able to join Dr. McKnight, our Board of Education, and some of our council members as we visited several schools and opened our new Harriet Tubman Elementary School in Gaithersburg. Dr. McKnight also announced that our schools are 99% staffed after fulfilling MCPS's needs for bus drivers and substitute teachers. Just a few weeks ago, our staffing numbers were short, but MCPS was able to quickly ramp up their hiring efforts. And as Dr. McKnight highlighted, MCPS changed their approach from passively waiting for applicants to find out about these jobs to them actually proactively going out to the community and looking for qualified candidates. And it's a very competitive market out there for teachers, nurses, and social workers. We've known that for a while, and pandemics only emphasized that. And it's fortunate we're able to provide MCPS with record funding this year to help them with these recruitment efforts, including the ability to raise pay levels to a more attractive and competitive level. I'm very optimistic about the school year, but we have a lot of work to do. We still know our students need to get caught up from the learning loss that occurred during the pandemic. I'm proud of the success we had over the summer with a couple of new programs like our new Ignite Hub and with our community partners such as the newly opened Kid Museum in Bethesda. These are lots of new opportunities for our students, young people, to learn and to experience things they don't normally experience. And these are great opportunities for everybody. This summer at Montgomery County Public Libraries, their summer reading challenge served 13,000 kids, more than any other year since they started this program in 2015. What I found interesting is that instead of giving away toys this year, Friends of the Library gave $5,000 to the Chesapeake Bay Foundation so that every kid who signed up for the challenge could help save the Chesapeake Bay. Reading goals were tied to activities like planting trees and regenerating oyster beds and helping animals like turtles and osprey protect their homes. Kids who participated also got a free book and were able to earn a pair of Nationals tickets if they read enough books. Thanks to our library leaders, supporters, parents, Friends of the Library for such a successful and innovative program. And reading is essential to the development of our students, especially our youngest children. I was a former school teacher, and the ability to read on level is so critical to having the comprehension skills necessary to tackle the more complex books they have to read as they get older. So developing reading early and strongly is really critically important to successful outcomes for our students. I look forward to more collaboration and partnerships between our government and MCPS throughout the coming school year. The success of our students just doesn't begin and end in the classrooms. We have to ensure that their education, safety, and health is supported in their homes and communities throughout the county. Parenthetically, I'll just say it's one of the reasons that I've been such a strong proponent for things like minimum wages and controls on rents in the county, is that as families struggle economically, the more the families struggle, the greater the impact on students. It's not simply a matter of not having money to buy things. It's a matter of the impact of poverty on the mental health and well-being of the students who experience it. And so this is a more complex issue than simply what's the size of the paycheck. It's what that paycheck does to help secure a safe and stable home environment for our kids. And would like people to ponder that. And that's a good segue into this coming weekend is Labor Day. And I'm proud to support unions. I always have, and support the importance of workers having a seat at the table. It's important that people understand the role of unions in creating a more just society. 8-hour days, 40-hour weeks, sick leave, pensions, healthcare, and outlawing child labor all came about because of the efforts of working people and their organizations. It's not like corporate interests suddenly had a moment of enlightenment and said, oh, maybe we ought to treat people better and pay them fairly. That's not the way it happened. These were the result of hard-fought, sometimes decades-long battles. And this is not unlike the battle for equal rights, civil rights, and women's rights, all things that for much of our history were opposed by the same corporate interests. And while it's good that much of the world has come to accept them in our society, it didn't happen absent the struggle of people to build better lives for themselves. And all of us here are better off for this today because of the work they did. One of my proudest accomplishments has been leading the effort to increase Montgomery County's minimum wage, which was passed in 2017 to raise the minimum wage incrementally each July 1st. This July, the minimum wage increased to $15.65 for companies that employ more than 50 people. The minimum wage is still below what is calculated as a living wage, meaning that even with this minimum wage, it is not a sufficient income to secure housing and meet the needs of many, many families. And it's something we're going to need to be talking about. More recently, I was proud to introduce a bill which would secure paid paternity leave for county employees who are also new parents. This legislation is currently under review by the council. I hope to see its passage this fall. We can see several labor victories in the last few weeks. Last week, I stood with SEIU Local 500 members as they fought for pay increases at American University. After 5 days on strike and 468 days at the bargaining table, the AU staff celebrated its first contract. I'm pleased that AU conceded to these demands, and I'm proud that workers earned more benefits. Again, the pay there is hardly what you would call a princely sum, but it's better than it was, and it's important that they were able to conclude this negotiation with the university. Unions also gain strength nationwide as young workers are driving a boom that's not been seen in probably 20 years or more. Amazon, Apple, and Starbucks are just a few employers seeing just how motivated the workforce can be. Here locally, I support the efforts of in Albany by Starbucks employees who recently shut down the store for a weekend to drive a clear message to their corporate owners that concerns need to be addressed. This Labor Day will mark the return of two community celebrations. The 55th annual Town of Kensington Labor Day Parade starts at 9, and it'll start at the St. Paul Park on Players Mill Road, and it ends at Noyes Children's Library in Carroll Place. Then we go back to the Gaithersburg Labor Day Parade after a 2-year hiatus, and the parade will wind its way down East Diamond and Russell Avenues from 1 to 3 on Monday afternoon in Old Town there. I look forward to seeing folks out there on Monday and showing my appreciation to the working men and women of Montgomery County. Abortions are now banned or severely restricted in at least 12 states. Additional 2 states now ban abortions at about 6 weeks of pregnancy. And more have announced incredibly restrictive measures that will harm a person's access to abortion services. Tomorrow morning, we're going to announce the details of the $1 million in county grants that will be available to abortion providers and organizations that support and help train them. We know that our providers in Montgomery County are going to potentially have to provide more services and support than ever before. These grants are something that I announced back in May when it became clear that Roe v. Wade would be overturned by the Supreme Court. The council reviewed the request, added some stipulations, and since then our Health and Human Services Department and our new Office of Grants Management have been working to set up everything needed to open the application process on September 1st. We're the first in our region to provide grants like this, and I believe this money will help save lives and assist women who have nowhere else to turn because of these draconian changes. Please join us here at the Executive Office Building in the auditorium starting at 11 a.m. to learn more about the grants program. Additionally, we're continuing our outreach to businesses that restrict the rights of women the businesses actually in the states that restrict the rights of women, as we continue to research specific corporations, companies, and organizations that might be considering moving out of these states and that are threatening the health and safety of their workforce, particularly their female workforce. And we're currently reviewing the marketing strategy on how to best target these states and the businesses there to tell them that, Montgomery County is welcome. We're a growing economy and we're an inclusive community, and we welcome all of your residents to Montgomery County, and we protect all of your residents all of your employees if you come to Montgomery County. Tomorrow, our county will pay tribute to the lives lost due to drug overdoses. Flags across the state are being flown at half-staff today in honor of International Overdose Awareness Day. Here in Montgomery County, we've seen 316 non-fatal overdoses since January. Last month alone, there were 8 fatal overdoses. Just 2 years ago, we were reporting a 20% jump in overdose deaths because of opioids and fentanyl. 2020 saw a 10-year high in drug and alcohol-related deaths, with close to 2,800 recorded. These are somber numbers and a reminder that this is a health problem that continues to need awareness and addressing. So I hope you'll be able to attend on Thursday. A resource fair begins at 5:30 and the remembrance ceremony follows at 7. Joining me today to talk a bit more about our International Overdose Awareness Day event and Montgomery Goes Purple, an initiative aimed at celebrating recovery from substance use and encouraging individuals to seek help and support. Laura Mitchell is chair of the county's Alcohol and Other Drug Abuse Advisory Council, as well as vice president for advocacy for the Montgomery County Council of Parent-Teacher Associations, and someone who's been touched personally by substance abuse. I'm now going to turn it over to Laura, and thank you for joining us today.
Thank you for having me. This is a very important topic, and as you said, I, like most people in the country, have been touched by this in one way or another. So I'm happy to talk about it.
Okay, go ahead and get started, Laura.
Okay. I wasn't sure if there were questions or yes. So this is our 7th year with the International Overdose Awareness Day ceremony and vigil. And that is a very somber event. We lose far, far too many people to this epidemic. Last year was the worst of all, nearly 300 a day. I remember when it was 98 and I was outraged, 98 a day nationwide. But 107,622 people lost their life to overdose. 135 of those were in Montgomery County last year. So it is significant, and it does touch nearly everybody in one way or another. And we wanted to give families an opportunity to mourn in public and in love and not stigma. One of the things that we find is that when you lose someone to mental health or substance use disorder, you don't get that necessarily outpouring that you get from other causes. And that stigma makes that grieving process very lonely and even more difficult. So we want to elevate that conversation about reducing this stigma, because that is also what gets us to that point. It is a huge barrier to people asking for treatment, people accepting treatment, and people offering treatment. And then being partners with those persons that are in recovery, keeping a job, getting a job is often very, very difficult. Getting housing, things like that for people who are in recovery. So it's made much more difficult by that stigma. And that's the point of the Montgomery Goes Purple, celebrating recovery, encouraging people who are in need of recovery, still letting them know that the resources are there, they're available, and they're welcomed. And that for those that are in recovery, whatever stage, early recovery is very difficult, but so is long-term recovery. It's every single day. It never ends. And it requires a lot of support and understanding. And I think we need more of that, more compassion. And reducing the stigma is a mission of mine. as is educating parents on signs and symptoms and what to look for. I saw things for years and I didn't know what I was seeing. So I want to make sure that others don't have that same issue, that they understand what they're seeing and know where to get help for their loved one.
Thank you very much, Ms. Mitchell. Members of the media, we're going to open it up right now for the portion of Q&A related to Overdose Awareness Day. Any questions from the members of the media for Ms. Mitchell and or the county executive?
Yes, here, Kate Ryan at WTOP for Ms. Mitchell. Ms. Mitchell, you anticipated some of my questions. I am wondering, is it getting any better in terms of acceptance among potential employers? We are aware of the stigma, and I know that, particularly in Rockville with some of the things they've been doing around this event, trying to let us know that, more of us are affected by this than we may realize. It could be our friend, our neighbor, family members, et cetera. But because people are quiet about it, it often, doesn't get the attention that it deserves. And people who are in recovery don't get the support of, the pats on the back and the encouragement. And that's a long-winded way of saying, have you seen it translated into workplaces and employers? And are there any employers you kind of want to give a shout out to who are providing a model for this?
There have been incremental improvements. I would say we are much better off now than we were 10 years ago. Are we where we need to be? No, not at all. It is very challenging, and particularly in early recovery, if they're justice involved and they have other requirements, or they need regular counseling visits or treatment visits, it's really challenging to say to an employer, I need to leave early 2 days a week to go to these appointments or these sessions for the support that I need to stay in recovery. So I am very adamant about building that support for everyone. And a lot of it starts with the language that we use and our policies in our charters and all of those things. When, for instance, we say, someone says to an employer, I have to go to drug court once a week. Would the reaction be different if it were recovery court instead? I think so. So those are some of the things where policy meets the person and really can have an impact. I don't want to shout at any particular employees or employers because I would miss some. There are some that are very, very good about it, that are really, really accepting and work with persons. There are some who have some work to do. We'll say that.
Okay.
But if you look around throughout the month of September, some of our employers are going purple with us. You'll see some construction sites with purple lights. You'll see many agencies for the county, the city of Rockville, Gaithersburg, others going purple. Look for those. And if people are talking to an employer, or they are an employer, they own a business, go purple. Put a purple light in the window. Put a purple light in your outdoor light or a floodlight or something. Show people that you are understanding and that you're supportive of recovery, and they can count on you.
Thank you very much. I have a quick follow-up for Mr. Elrich. You brought up a stat. I think it was 316 overdoses, non-fatal, so far this year since January. Do I have that right? Do we know how that compares to last year? Are we up or are we down? How are we looking?
I don't have that number with me. Maybe somebody from the health team knows what the relevant number is.
I can try and check back with them.
Yeah, we can get you an answer.
Thank you. Thank you very much. Thank you very much, Ms. Mitchell.
Thank you.
Thank you, Kate. Any other questions regarding this topic for Ms. Mitchell from reporters? Going once? Going twice? Okay, we're moving forward with a public health update. Mr. County Executive, thank you, Ms. Mitchell, for joining us today.
Thank you, and I hope everyone will join tomorrow night.
Thank you.
Yeah, thank you for being here. So I'm going to go on with the health briefing. Case rates for COVID-19 and hospitalization numbers continued to trend downward, keeping Montgomery County at the current community level at low. It's encouraging news until you look at the number of deaths attributed to COVID in August. We've seen 9 deaths in just the last week, bringing our deaths this month to 29, which is in line with what we've seen throughout the summer. Since the start of June, we've averaged nearly 1 death per day, with 88 people in Montgomery County dead because of COVID. And many of those patients that lose their lives to COVID are unvaccinated. The number is pretty much the same as it was before, 4 times more likely to end up in a hospital and 4 times more likely to die if you get COVID and you're not vaccinated. That's one reason I still think it's important to talk about why vaccines and boosters are so important in the fight against COVID. The health risks between the unvaccinated and not boosted compared to those who are is exponentially greater. And I remember a time when most people would never wear seatbelts, and plenty of folks smoked a pack of cigarettes a day. Not as many do anymore because it's just plain stupid and essentially suicidal not to do those things. So behaviors have changed as the health consequences become, I guess, more obvious. Not getting vaccinated is kind of the same mentality at this point. There's no reason really for anybody to get severely sick with COVID anymore. Not really any reason for anybody to die except under the most exceptional circumstances. And so the fact that we're still seeing hospitalizations and severe cases of COVID and death it's just sad because it doesn't have to happen. There are 88 people, since June who didn't have to wind up dead if they had gotten vaccinated, and that's just really unfortunate. During our COVID briefing this week, I want to focus on this map that our HHS team pulls together every week, and it shows areas in the county with the lowest levels. I asked HHS what they're doing in these communities to help improve these rates, and we're doing a lot of targeted outreach through our minority health initiatives and our community clinics and working with schools in these areas. But we're going to need to do more. Outreach is a key component. And I'd like to focus on this as we try to get more people vaccinated, especially before another variant and surge hits us. And it's what it's done for the last 2 falls and winters. So we have a pattern, and there's no reason to believe we won't repeat that pattern. Just a few hours ago, the FDA announced it has authorized the use of the new booster shot, which was retooled to tackle the Omicron virus, and our health department is preparing for its arrival. I hope that this is a game changer and will help us increase our booster rates. For a county with nearly 90% fully vaccinated, I'm frustrated that we remain below 60% in our booster rates. Those numbers need to come up. Additionally, the federal government says Friday is the last day to order free test kits from them through the mail. We don't have any plans to end our free test kit distribution yet. I want to thank everyone for continuing to pick up at-home test kits. And I really appreciate our library system for being such an effective distribution point. It's important that we're able to get these kits out to people. More than 30,000 are being taken home weekly across the county. And now that school's back in session, I encourage all families to continue to acquire and to use these tests when you think you need to. On the monkeypox front, MPX, as we're referring to it also, earlier this week, the federal government announced that it'll spend $11 million to develop a smallpox vaccine to combat monkeypox. It comes as the Maryland Health Department shared for the first time breakdown information of nearly 500 MPX cases across the state. Montgomery County has identified more than 50 cases, or a little more than 10% of the cases in Maryland. Prince George's and Baltimore City lead the state in monkeypox cases. We just received word that we'll be getting another shipment of MPX vaccine. That, along with changing the way we administer the vaccine, means there are going to be many more doses available. The county's continuing to work to vaccinate the close to 3,000 people on our pre-registration list. Another virtual town hall on MPX is planned for Monday, September 12th from 6 to 7:30 with a focus on the Latino community. So at this time, I'd like to bring Sean O'Donnell and Kimberly Townsend from our Montgomery County Health and Human Services Department to talk more about our ongoing health threats, and then we're going to take your questions.
Sorry, I was having a little trouble unmuting.
You got this, Sean?
I do.
Okay.
Okay. Thank you for your patience. We'll go through very, very quickly with today's pulse report. There have just an update. We are, of course, tracking the variants. We are seeing a little bit more of a percentage of variants going to the BA 4.6 right now, but still a very small percentage. This is mostly BA 5. As the county executive said, though, our case rates are decreasing and have been for a little while now, and our hospitalization rates are again under 10 new patients per 100,000 and under at 10% of our hospital capacity. So we are still in the low community level. There are lots of transmissions happening out there. We're still caution people who are at risk to protect themselves, wear masks if they're in crowded areas, and of course stay up to date with their vaccinations. But with the decreasing rates right now, we're not seeing these spread quickly. Again, just a little more detail on our hospitalizations. We still have 47 patients at the alternate care facility in Tacoma Park, but overall we are seeing some mild decreases in hospitalizations with COVID patients. Again, we just want to remind everyone we're continuing our vaccination efforts 7 days a week at various locations, of course, at our Montgomery County Public Schools on the weekends and a couple elementary schools on Wednesdays. We are doing vaccinations on Wednesdays and Fridays at the East County Regional Service Center, and that is a new location for us recently. So if we have folks who are in East County and need a booster, please check the county website for the specific details. But essentially, we're there 10 to 7 on Wednesdays and Fridays now. There is, I know we've mentioned that 2 new vaccines have been approved. These are the bivalent vaccines. They'll include some protection against the most recent Omicron version, BA5. And the hope is that as future variants come out, they have closer relation to the more recent variants. And by including an effective vaccine against that, we'll have more protection going forward. So this is a lot like the flu vaccines that come out each year that include multiple strains of flu that it protects you against. This will now protect you against more than one strain of the COVID variants. So we're looking forward to that. We have already ordered doses through the state. We're hoping that our private sector partners in pharmacies, in urgent care, and other places people go to get vaccinated also will have those doses. You can use the same process if you're trying to find a place with this as before. Either check our website or the state or federal vaccines.gov that you can search for a specific vaccine. Again, it will be a few weeks before we have those in hand. And we're looking forward to some additional guidance coming out from CDC on if there's any differences in timing or so forth. So far, those new vaccines are just approved for the Moderna will be approved for 18 and above, and the Pfizer will be approved for 12 and above. We know in this county that's largely people would be looking for this as a booster. But if there are individuals who have not yet been vaccinated, they can also get that as their initial doses. At this point, I'd like to turn it over to my colleague, Kimberly Townsend, to just add a few more points on our strategies for vaccinating with monkeypox.
Thank you, Sean. Just briefly, you can see the current cases in the state of Maryland are at 484 as of August 30th, and nationwide just a little bit above 18,000. Earlier, it was mentioned that Maryland Department of Health now has a data dashboard. So this is just a quick snapshot of what you'll see when you go to the dashboard, and you can see there's some information about different jurisdictions within the state, including our county. Just want to remind everyone that we are providing mitigation in terms of vaccinations within priority groups. Priority 1 group, of course, is our traditional post-exposure prophylaxis, and those are, of course, public health identified contacts of known cases. And in addition to that, healthcare and lab staff that are exposed to MPX. We are also currently providing vaccination to our priority 2 groups, the highest at risk. And those, again, as we have discussed before, those self-identified contacts of known exposures and those other high-risk impacted community members. Again, moving on to pre-exposure prophylaxis will be based on vaccine supply that we receive from Maryland Department of Health, and plans to do that in the future would be done in conversations with our partners at the state. And so more to come on that. The good news about receiving more doses of vaccine is that we will be able to have enough to send out invitations to those that have enrolled on our pre-registration site within the next week or so. We've had just over 3,000 responses. We are increasing our capacity. We're providing appointments. We did 750 this week and another 800 for next week. So we'll continue to do that. And I believe the other updates have been covered. So that concludes my update for MPX, and I'm happy to take any questions.
Thank you very much, Ms. Townsend and Mr. O'Donnell. Dr. Stoddard, do you have any opening remarks today for us?
I do not. I'll just answer during questions.
Okay, wonderful. So let's get started. Kate Ryan, WTOP, I see that you have more questions in the chat. Is that the case?
Yes, thank you very much. I just wanted to make sure on the new vaccines, the bivalent vaccines, did you say precisely how many of those are going to be made available?
I don't know how much is coming into the state. We did place an order for Pfizer and Moderna, an initial quantity more than 1,000 doses. That would be a significant increase from the number of boosters we're doing on a week-to-week basis right now, but we think the demand will be up. And that's just at the county sites, the county operated sites. The other private sector should have lots more as well. What we have heard is there might be just a little less availability of the Moderna right now than the Pfizer. But again, it may be different for other folks. That's been our experience.
Okay. And again, on the monkeypox or MPX vaccines, how many do you expect to get?
We have asked for 2,000 doses from the state in order to comfortably get through at least the people who've reached out to us and said that they believe they've been exposed. I believe have just maybe received today some additional vials. One of the challenges with that is we're still trying to learn how many doses we can get out of a vial. We know it's in an ideal situation, it'll be 5 doses out of a vial for those that can receive the intradermal. So we've been giving lots more shots intradermally now. We started last Wednesday. We did it yesterday. We're doing it today. We've been doing it since Monday as well. And we're keeping tabs on that. We're hoping if we can get 5 out, that would mean we have 2,000 more doses. But right now, there are a few people who, if someone is under 18, they need to get a full dose. So the math isn't quite exact yet how many doses that will be, but 500 additional vials.
Got it. And just lastly, to follow up, when you said Earlier you talked about 3,000 people on the registry for monkeypox. Does that mean those people believe they've been exposed, or no? Are we talking about two different populations there?
It can include both. We did indicate in our outreach and on our website, that this right now we were trying to capture people who had likely been exposed in the last few weeks. Of course, there have been some people who responded, and based on their answers, it does not look like they have that risk factor, which is okay. They're still interested in getting it, and at a certain point, when we are able to go to the pre-exposure group, we will have some guidance over who should be signing up for that. Again, the rest of the population is pre-exposure technically, but we'd like to, as we move to the next group, talk about what's the next set of risk factors. Again, we'll have to look at where cases are, and that is evolving over time. So we'll be talking with our state partners about that, so that we're hoping that the jurisdictions will use the same criteria as we go into that pre-exposure group.
And
Thank
Kate,
you.
Kate, just to add, we aren't going to hold any doses per the request of our county executive, Mr. Elridge. We've had conversations before where there's demand, and we know we have a higher response rate versus the demand. So we're going to get all of those. We're going to go through the list, and those individuals who responded to our pre-vaccination survey, we are going to honor those and get those shots in arms. And we've had multiple conversations, as Mr. O'Donnell and Ms. Townsend indicated in their updates. So we've identified the folks that we need to administer those vaccines to.
Thank you both very much.
And I just want to add one more piece, actually two pieces. So first off, we don't always do this, so I want to say thank you for the Maryland Department of Health and to the governor's office for hearing our request for more vaccine and actually being responsive to it and getting us some additional resources that, obviously we need them. We've got a large registry that has demonstrated need. And Kate, to your earlier question about I pulled some of the opioid data if you're interested.
Oh, yeah.
And so there's 3 measures that I have access to here. I probably could find the other measures that we talked about. But what I did is looked at, we got 3 different data sources here. But I want to be clear. So the more recent months, July and August, are not always available in all 3 of these data sets. So I compared the 6 months prior that we had data for. So ED visits, January to June 2022. We had these are overdose related. This could be alcohol and or opioids overdose. We had 248 this year compared to 351 in 2021. For Narcan administrations by EMS during the same period, January to June of 2022, we've had 272 compared to 324 last year. And then for drug or alcohol related overdose fatalities, we have 45 this year from January to June, and we had 66 in 2021. So all 3 of those measures show a reduction in 2022 relative to 2021. And obviously we'll be monitoring the July, August, and through the end of the year to see whether that maintains or whether we see a late year resurgence. But generally speaking, all 3 of those measures are supportive. And one comes from the CRISP system, which is the hospital ED data. One comes from police investigations, which is the overdose fatality. And obviously the EMS comes from fire rescue in Montgomery County. And so they're all 3 different data sources, which tell a similar story, which there is a reduction in 2022 relative to 2021.
Thank you very much. I appreciate it.
Thank you, Kate. Steve Winnell, Bethesda Beat, you're next. Good afternoon.
Good afternoon. I just want to ask about these new vaccines that are approved for COVID. Are they like the Johnson & Johnson vaccine or not them? Or I'm just curious how the vaccines themselves work, and anybody from the health team could kind of field that, I guess.
These are the Pfizer and Moderna vaccines. So I believe one of the 2 components of the vaccine will be the same as has been in all the previous vaccines, and they're adding an additional component that will help provide protection against BA.5 and similar variants or similar spike proteins. So these will both be mRNA vaccines like the previous Pfizer and Moderna's have been.
And so, Steve, just to add, so they're different. We have the Johnson & Johnson, that's vector, and we have the Pfizer and Moderna, that's mRNA, and then we have the Novavax, that's a protein. The Pfizer and Moderna will specifically look at not only the previous strain of the coronavirus, but also the BA4 and BA5, as Mr. O'Donnell indicated. The other point that I want to make is that while they have been approved by the FDA, we still need to have the approval over the next couple of days by the CDC's ACIP before we actually will receive the clinical guidelines, and then we'll be able to put those boosters in arms. So that's the sequence of events, and a little more about the differences. So it's not like the Johnson & Johnson, but it is an update and in addition to the mRNA vaccine, if you will.
And let me actually clarify something I said earlier. Right now, and again, we're going to learn more about this in the coming days. Right now, it looks like it hasn't been approved as a first and second dose, just as a booster. Again, the predominant vaccinations in our county right now are boosters for those ages. So that shouldn't impact a whole lot of people, but we're going to learn more about this as they come out.
Apologies if I missed this, but I know the county executive was mentioning the deaths from COVID this month. I think over 20, he said. Are the majority of those from unvaccinated individuals? Do you have those, and even have those numbers handy, I guess?
Let me see if I'll pull up the relevant slide.
And so, Steve, while Mr. O'Donnell's pulling up that, one of the questions that hasn't been asked yet, but let me just preemptively provide some additional information. We have been working closely with our Montgomery County Public School partners. This is the first week return to school, so we are actively monitoring any surges or uptick in cases. We haven't seen any. We know that there's a mask option, unlike last fall. And so Ms. Townsend and her team has been doing significant work with our partners, not only looking at the return to school, but those school age students who are eligible for immunization. So all of those things come into play when we're looking at a return to school. So just wanted to share that with you and the other reporters this afternoon.
Is that it for you, Steve? Any more questions? Sean, you got it.
Yeah. I did pull up the chart here. So sharing here, you can see the month by month deaths in Montgomery County with a COVID diagnosis and deaths at the state level. And if you look at the chart on the right, these are the death rates by vaccination status. The dark blue line, which is the highest rates across the board, that is the unvaccinated populations. Now we know this is a very limited number of people in our county that are unvaccinated, but that's why we're looking at incident rates per 100,000 here. So the likelihood of someone dying from COVID if they're unvaccinated, that risk factor changes over time based on what variant we're dealing with. And again, the numbers are pretty small, so you see it go up and down a little bit rather than a smooth curve. But you can see that rate is consistently higher than the light blue, which is fully vaccinated, and the orange, which is boosted.
So in raw numbers, we're for like the past month, maybe a few people who have had the vaccine have died. I guess compared the vast majority, I guess, because these rates are good. I guess it just isn't the raw numbers that are in front of me here, if that makes sense.
That's correct. That's correct.
Okay.
It may be, again, it's harder to understand your risk when you're vaccinated or unvaccinated if you're looking at the raw numbers, because such a large proportion of our county is vaccinated. But again, the unvaccinated make up a disproportionate number of our hospitalized populations and the populations who die from COVID.
And I want to switch to monkeypox. Maybe Ms. Townsend could handle this. I think you said that some of the vaccines are going to the private sector. Correct me if I'm wrong. If that's the case, do you know roughly how much the private sector is getting, or is it all through kind of the Maryland Department of Health at this point?
So right now, the vaccine that we receive from the state, we are providing here at the Dennis Avenue Health Center site. We do provide vaccination to those that are referred by private providers in our community as well. So it's anyone that meets those priority groups and anyone that is pre-registering on our site.
So do you know how much percentage-wise is going to those private providers roughly then, or?
Right now, it's all referrals from them to us.
Okay.
We have heard that the federal government is working with the federally qualified health centers, which is some of which are make up our safety net and Montgomery Cares clinics and within Montgomery County. I don't know that they've received any. I don't think they've received any yet, but they're working on getting some out to those groups as well. Of course, as Dr. Bridgers, I think, mentioned last week, we've reached out to these providers. They're all aware that we have the vaccine. They are all aware that if they have a patient, they can refer over to us. What we've asked of our providers is that they continue to offer screening and testing to all of their clients, the way they do for other health-related risks, and that they continue to do that. And if they do have a client with a positive result, of course, then that gets followed up by the state and local health departments as part of the disease control contact tracing process.
And I guess my last question, hopefully, is, you've talked a lot about your vaccination efforts for this. How much of is all your day-to-day just educational about what this disease is, kind of combating misinformation, much like with COVID, honestly, with this kind of new, not everyone knew about monkeypox until it started being the headlines a month or two ago, however long it was.
Sure, Steve. I'll respond to that. Thank you for that question. So a lot of outreach, daily communications at the federal and at the state level, multiple calls with not only our MBH, but also our partners, as well as Mr. O'Donnell indicated. We continuously assess the needs and support of our Montgomery Cares clinics. We've also reached out to our hospital partners and our urgent care. Most of the support that we're providing is through education, outreach, referral, testing, vaccination, but we're also working with the district. We know that individuals may have been vaccinated in the district because of their employment status. However, for that second dose, they may have to return to the county. So we need to accommodate for their full vaccination as well. So it's a lot of planning, a lot of organizing extended clinics. We know that folks need to have access on the weekend and in the evenings. So Mr. O'Donnell and Ms. Townsend's team are working not only to make the vaccines available and accommodating, but also to inform individuals. So throughout sexual health, we have education as part of that vaccination strategy as well. So you just don't get vaccinated. You get additional information about close contacts, about those transmission challenges that may occur. So we're doing a lot of education, testing, and vaccination as well as part of our response to MPX, a trifecta, if you will.
Thank you, everyone.
Thank you, Steve. Members of the media, I do not see any more requests for questions on the chat. Does anybody else have any other questions for the officials today? Okay, going once, going twice. I guess that's it. I guess we're done for today. Thank you, everybody, for joining us. We'll be back next time, very likely next week. Stay safe. Have a fantastic afternoon. Bye-bye, everybody.
Thank you.
Have a good night.